Welcome. So I want to thank you all for joining. This is a very important briefing on the CAS, that's the Collaborative Action Strategy. I'm sure we've heard a lot about HCE, the health campaign effectiveness, and we're very proud that Nigeria is one of the 2 countries that are the focal points piloting this initiative. So before we begin, I just want to go through some ground rules, housekeeping points. Let's be mindful to put ourselves on mute, and there'll be a question and answer session at the end. But you can drop your questions in the chats and we will collate them and go through them when the time is appropriate. This session is recorded and there is going to be there's an AI note taker for the process. I'll start with a brief introduction. My name is Zayanat Abubakar Umar. People call me Zaya. I'm a technical assistant to the Coordinator Minister of Health and Social Welfare here in Nigeria. That's Professor Muhammad Ali Pate. And one of my focal points is the health campaign effectiveness. And joining me today is Dr. Sheo Hassan of the National Primary Healthcare Development Agency as well. She's the focal point for CAS also on the point of the NPHCDA. And also we have with us Kristen Silas. She's the Director of Health Campaign Effectiveness Coalition Program Office at the Task Force for Global Health in Atlanta, Georgia. So we'll go through the meeting agenda very briefly. Just a moment. Okay. So basically, we're just going to go through an overview of what the HC is about, the CAS, and then what Nigeria has been able to achieve and the key next steps for Nigeria in regards to this. We'll start off with what the CAS is about and the HC coalition. But before we go into the Nigeria updates and key next steps, I'll hand over to Chris to walk us through the HC coalition, how it all started and how the CAS came about and was developed. So over to you, Chris.
Thank you, Zaya, and it's great to see such a big crowd today on the call, and appreciate Nigeria inviting us to be part of the stakeholder meeting. Many of you, I can see from the names, are very familiar with Health Campaign Effectiveness Coalition, and many have been with us from the very beginning, including some of our Gates donors here. And also the Nigeria team, who's also been extremely active with the coalition from the beginning. So I thought I'd just give a brief overview of what the coalition is for those of you who are new to it, but share a few points about the new collaborative action strategy and then turn it, as I said, to Nigeria to talk about their plans. So we're all familiar, I think, with the challenges around campaigns. We're working in a very fragmented campaign ecosystem, and it's really grown. The challenges have been growing over the last 25 years when we've seen a growth in all these disease-specific initiatives, each with often their own financing and their own set of goals and targets. And so that's also led to proliferation of different health campaigns, also targeting those very specific diseases. And we know that happens. We've met a lot of the key goals, but also that's also created a lot of challenges around coordinating between our different programs. So we know over time we'd love to improve and strengthen our health systems, but in the short term, we have a lot of work to just focus on how health campaigns themselves can be more effective and also align with the primary healthcare system. Next slide. So this was sort of the foundation which launched the Health Campaign Coalition in 2020. And so really the coalition was founded with the idea that we, different campaign programs from immunizations, polio, neglected tropical diseases, malaria, vitamin A supplementation, and all the different neglected tropical diseases really can come together and think about how to share some of their best practices, identify what's working, what are their challenges around campaigns, think about how to reduce fragmentation, harmonize some of the financing issues, and really strengthen, again, the collaboration coordination across the different countries, funders, and campaign implementers. And so the coalition has a strong leadership team. I'm seeing several members from our leadership team even joining us today, with representatives from WHO, UNICEF, CDC, Carter Center, World Health Organization, Global Fund, Gavi, and the task force. And of course, as you see there, and Bill and Melinda Gates Foundation, see there also the Nigeria Primary Healthcare Development Agency is part of our leadership team also from the very beginning. Next slide. So during the first few years of the coalition, as I said, we were looking at what do we know in terms of what works best, what are some of the challenges, and how can we look at more collaborative and integrated approaches to our campaigns. So we supported a number of implementation research studies, and again, Nigeria was a recipient of several of those across 15 different countries, looking at, again, ways that we can better collaborate around campaign planning, thinking about ways, especially engaging the community and a more participatory approach during implementation, identifying different digital tools and other approaches that help us improve our monitoring and evaluation of campaigns, and also identifying what some of the barriers are around campaign financing. And there's quite a few of those that have been surfaced. So this body of sort of evidence is really what is underpinning the collaborative action strategy, and has surfaced a lot of these best practices. And you can find the studies from these implementation research projects and different case studies on the Health Campaign Effectiveness website. Next slide. So again, what is the collaborative action strategy? So as I mentioned, we took a lot of these recommendations and findings that we had learned over the last few years, and last year came together with a large group of stakeholders, over about 50, from countries, from regions, from global partners, to think through each one of those findings and come up with a set of recommendations. And so it was a very collaborative and sort of co-created approach to develop the CAS. And the CAS is really meant to align with all of the different projects and strategies that are out there, but really to think about how we work differently together. So it's a way to shift the way that we're doing our work so that we're doing it in a way that is more coordinated, that identifies and clarifies roles and actions and approaches that we can take at the country level and also at the global level to really transform the way that we're working and improve, again, our outcomes. Next slide. So also the full collaborative action strategy, the document and a slide deck is on the HCE website. So when you open up the CAS document, you will see a set of 12 different recommendations. And again, these are really meant to be flexible and adaptable. We're really allowing each country to decide how they're going to adapt each one of these recommendations to their own country context. So there's a set of recommendations, there's 12 of them. They cover 3 different areas. The first area is on planning and implementation. The second one is on monitoring and evaluation, or MERLA, monitoring, evaluation, research, learning, and adaptation. And the third set is on campaign financing. I'm not going to read through each one of these, but I do want to highlight a few of them because I think this was really some of the key sort of shifts that we're thinking about when we think about the impact of the strategy. So in the planning and implementation side, one of the first recommendations is for the country to establish some type of multi-sectoral or cross-campaign coordinating body. And I think we'll hear later on what Nigeria is already doing in this effect. And then to identify where those are campaigns that are happening and which ones are best positioned for a more collaborative or integrated approach. We know we can't integrate everything, but there is an opportunity to really think more carefully around which campaigns can be integrated. And integration being across the spectrum of collaboration and versus co-delivery only. And then for each country to come up with a more of a multi-year or cross-campaign calendar or work plan. And this is really going to set their opportunity for how they can do the rest of implement the rest of the CAS. So again, the CAS looks at ways to harmonize tools across and around supply chain or micro planning across our different campaigns. In the M&E section, it recommends that each country come up with a coordinated MIRLA strategy that again pulls in all the different ways to harmonize some of their data so that they have shared information around different communities and the community needs. And also looking at ways that they can harmonize and align around campaign financing. There's some recommendations here that are specific for the global level, and again, to look at across for M&E, more of a global guidance around campaign effectiveness, since many of our programs all look at it slightly differently. And then also around financing for the global donors in particular, to think of ways that they can be more flexible with their funding and harmonize and incentivize ways for countries to use a more collaborative approach to funding campaigns. Next slide. So that's sort of the basis of the recommendations. What do we hope to achieve through the implementation of the CAS? And again, this is for each country to think carefully about what campaign effectiveness and campaign success looks like for them. But ideally, through implementing the CAS, we anticipate there will be reduced fragmentation and increased coordination or integration across the different campaign programs. This should lead to more efficient and effective use of resources and more streamlined approaches across especially around monitoring and evaluation. We anticipate, again, changes and shifts to harmonize funding and processes, and a way to think through how our campaigns could be more supportive and aligned with the primary healthcare system. And ultimately, we're looking at a more equitable and high quality and accessible people-centered approach to delivering services. Next slide. So when we launched the CAS, and again, it was just approved in December of 2023, so this is very new, we invited a few countries to be the first to implement it, and we're calling them focus countries. So Nigeria as well as Ethiopia opted in to be the first two countries to implement the CAS, and we'll hear shortly from the Nigeria team on what this means to them. But one of the few there's a set of sort of underlying principles that have been guiding the work that we're doing at the coalition. And the first is the belief that the CAS needs to be country-led. So the coalition as a whole came together to develop the strategy, but the implementation is really for each country to think through what does success look like for them, and how will they customize the CAS to their own country, context. Our coalition leadership team has made a commitment to the focus countries that they will be there to support them. They will help mobilize staff or resources, support technical assistance, and facilitate any changes that need to happen to really support the focus countries through this next few years. We also know that CAS is not going to be easy. And it is an approach that is really requiring all campaign partners at the country level, government, the funders, implementing partners, community health workers, and others to really break down those silos and to collaborate and work very differently towards some shared goals. So this is a multi-sectoral collaboration at the country level, and also engaging many of the partners at the global and regional levels. And through this process, it's really an opportunity, since we're just starting with a few focus countries, to really learn from you in terms of what is it going to take to implement the CAS. And we know there's going to be a lot of learning and adaptation along the way. And the coalition is there to support this learning process, and also to facilitate and share our learnings with the broader coalition. So I will end there and turn it back to Zaya. I'm excited to hear about Nigeria's plans. Thank you.
Thank you very much, Chris. And I would like to say that the leadership has truly been there in terms of the support and setting the leadership and given the full backing in terms of achieving the CAS in Nigeria. So, like she said, the aim is to get the collaborative action strategy into the Nigerian context. And we as Nigeria are proud to be part of the focal groups, sort of the lighthouse for the rest of the world to set this pace. Um, like she said, it's not easy, but we're going a step at a time. But Nigeria has gone further steps ahead in the fact that there's the introduction of the sector-wide approach and the strategic vision for Mr. President, which is in line with what CAS is trying to achieve. So on this note, I would hand it over to Dr. Hassan Shehu to give us an update of what Nigeria has been able to achieve so far and the next steps with regards to customization of CAS in Nigeria.
Okay, thank you, Chichi. Thank you, Christy and Patricia and colleagues on call. So I will be taking the Nigeria CAS implementation. Thank you. Next slide. So I will start with a high level timeline for the CAS itself. For the phase one, which is the implementation in focus country, the CAS recommendation will be customized to a country context. Also execution and collaboration in countries, then learning, knowledge sharing, and dissemination occur. And lastly, the robust socialization and alignment within the leader of team for all the organization and campaign ecosystem. And for the phase one, which we have now, from 2024 to 2025, from the previous slides, it was said that there was a meeting in Addis early this year, with broad participation from global, regional, and country stakeholders, which Nigeria, the Federal Ministry of Health, and NPCD staff, and also Ethiopia participated. This will run from 2024 to 2025. So in phase two, that is 2026 to 2027, for the focus country, the outcomes and learning from them will be analyzed, and also the CAS and recommendation also will be scaled up beyond the focus country within this year of phase two, that's 2026 to 2027. Next slide. So for the current activities and high-level next step for CAS implementation in Nigeria, I will take it under these thematic areas. For the engagement, that is the Federal Ministry of Health and NPCDA. After we returned from the Addis, the briefing was done. That's for both the MOH and NPCDA. And the Honorable Minister, Coordinating Minister for Health and Social Welfare endorsed the CAS. And also now the Director of Public Health and ED NPCD have been recognized as the lead for all HC activities in country. For the Secretariat, it's already established and sit at the office of the Honorable Commissioner, Coordinating Minister of Health and Social Welfare, with support from the NPCDA and Office of Director of Public Health. The TA being recruited to support secretarial function, including coordination across health program of effective campaign and also implementation. Also, we have the timeline. The first one happened in February, while this one will run from March to April. That is the CAS Secretariat. For the feasibility opportunity assessment, this already started today. The objective under this is that we have already have a list of people to be interviewed under this assessment, and this has started today. And the objective is to understand the current campaign practices, capacity, and resources available and needed for the CAS customization and execution, and also to identify the risks, challenges, and opportunity to CAS implementation, and also as well as current and required partner for CAS customization and implementation. The timeline is April 2024. For the CAS customization, the campaign and stakeholder mapping conducted to understand which aid program to include in CAS for co-delivery of campaign. The CAS is being considered under the SWAP to address 4 key points in Nigeria's strategic vision for health sector from 2023 to 2026. The stakeholder engagement meeting, where we have the TWG and also develop the TOR for a subgroup under planning, implementation, MELA, policy, and finance, is slated for 22 to 23 April 2024, which will happen next week. And activities already have started on this. We started, a kind of securing the venue for where this will take place. Next slide. So the contextual factor driving CAS implementation in Nigeria. So I'll start with the background. We all know the country is a signatory to numerous global targets for the elimination and eradication of diseases like ococariasis, measles, polio, yellow fever. We also have MNTE. So recognizing this complexity of this goal, campaign as a strategy has been employed to bridge the gaps and quickly attain the goals. So this campaign are planned for and also implemented within Nigeria health ecosystem. However, as we move toward attaining the goals, this has inadvertently led to fragmentation within the health system, stretching of resources, then also campaign fatigue among stakeholders. Consequently, this disruption has impacted the traditional and consistent provision of health service at the facility. For the vision for the country, the government of Nigeria has set out a strategic vision for the health sector from 2023 to 2026 with the goal to save life, reduce financial and physical pain, and also produce good health for all Nigerians. Then competing health priority and program are being aligned as part of the country goal to, one, reduce the frequent outbreak of diseases and meet disease elimination and eradication targets, and also increase efficiency, improve access, and save costs with introduction of new medicine, vaccine, and also programs. Next slide. So this is the government of Nigeria, the vision we mentioned before for the health sector from 2023 to 2026, with the goal to save life, reduce both physical and financial pain, and also produce health for all the country. And if you look at the four pillars you are seeing, you will see that the CAS itself happen to be in line with the 4 mark points in Nigeria's strategic vision. Next slide, so that we can see the 4. Next. So 1, you can see the improve the ability to detect, prevent, and respond to public health threats like cholera and Lassa. Next. Next. Also drive health promotion in a multi-sectorial way. Then strengthen regulatory capacity to foster the highest standard of service provision. The last one. Next, to improve cross-functional coordination and effective partnership. Then lastly, MPCDA also have their strategic blueprint. Next, which also align with the government vision, and also CAS is also aligned with this. If you look at the pillar 3 and the priorities under it, align with what we are looking at as CAS collaborative action strategy. And so this is what we have. Next. So thank you very much. This is how far we have gone in Nigeria implementation. Thank you. So let me hand over back to Zaya. Thank you.
Thank you very much, Dr. Hassan. So we are quite excited. Like next week would be the official kickoff with the establishment of the inauguration of the TWG for CAS. And the plan is to get the CAS with subsections focusing on those key areas that were mentioned during the presentation. That's in terms of MERLA, in terms of planning and implementation and financing. And there'll be a brief sensitization at the beginning of the meeting before we kick it off. And in the meantime, feasibility assessment has already started, like Dr. Hassan mentioned. We've started off with some interviews, and part of the team is in country. I think Linksbridge is already around. The Canberra team will be joining us by next week, and they'll continue with the feasibility assessment just to know where we are in terms of health campaign mappings. And Linksbridge has done the honors of helping us to do a campaign mapping, so to speak, on what is actually on ground and where we have opportunities for integration and delivery in an effective manner in view of the health campaign effectiveness. So on this note, we would take the questions and answers. We are very keen to hear your take on this and how some of the stumbling blocks you might envision us having with regards to this. So Q&A. I think there are some in the chats, Chichi.
There's a hand raise.
Okay. Yeah, I think you can unmute yourself and speak.
Yeah.
Hello.
Yes, we can hear you. If you cannot, go ahead and with your question or comment, please.
Yeah, thanks. I'm Dr. Nasir Yusuf with the WHO headquarters in Geneva. Let me start by thanking Dr. Hassan for the presentation and vision the country is taking in terms of addressing public health issues, and particularly the idea to sort of streamline most of the campaigns into a more effective way of doing business. I just wanted to find out that I see that there are a number of timelines, but I'm not sure it's clear exactly when implementation of these integrated campaigns will start, given that most of the campaigns in Nigeria are in response to outbreaks. I do recognize that some of them are actually to address the goals of eliminating diseases and all the rest, but I guess that most of them will be in response to outbreaks. So it would be nice to put a timeline. How soon, because the outbreaks will continue. So how soon are we likely to begin to implement campaigns in integrated manner? Thank you.
Should we take the questions as they come or all at the end?
Perhaps we can take a few questions. I think we have 5 hands raised right now, so maybe we could take all of them and then we respond.
All right.
Yes. I think the next hand up is Usman Adamu. Please, you can unmute yourself.
Okay, good afternoon, colleagues. Usman Adamu from WHO Afro. Thank you, Christy. Thank you, Zaya. And Shehu, so glad to see your presentation and very excited to be part of this meeting. It's really, my question for Nigeria is as a proof of effectiveness of this concept. I know that there are plans for 18 states for polio outbreak response in the next 2 or 3 weeks. How are there plans to really to demonstrate that we are really collaborating to see how efficacious our drive to really bolster immunization in this plan, or any other intervention that seeks to actually ensure effectiveness of all our campaigns together? I mean, to demonstrate sort of, Yusuf has really alluded to that fact, but I do need to ask, what are the plans between the polio folks and the guys, driving immunization in Nigeria, or any other intervention, especially our plans in Nigeria to implement a measles mass campaign? Is it in Q3 or Q4 this year? So I sort of think to just place this question on the table. Thank you, and over.
So perhaps one more, then we take 3 and continue. I think it was Mrs. Mugekwi Omoluabi.
Good afternoon, all.
Good afternoon, ma'am.
Hello, thank you. I'm Mrs. Mogeku Grace from Federal Ministry of Health, Nutrition Department. I want to say thank you for the presentation and clarification on this concept. Well, I'm really having concern because if we talk about diseases, there are so many things that causes that, and nutrition is also key in fighting or improving the health of an individual and the society at large. But I couldn't really see, maybe I missed it, where nutrition was mentioned in this presentation. And I know that malnutrition is also public health challenge that we should also be looking at also, and also see how we can campaign on the issue of nutrition to ensure that everyone stays healthy. So I wouldn't know if there will be room or opportunity for nutrition to still be captured into the work plan that has been presented, because this is my first time of attending this meeting, and I'm very, very happy to be part of this meeting. Thank you very much, and over.
Zaya, maybe before you answer those questions, I just want to highlight one that came in through the chat earlier. On the Q&A, it says, what is the role of academics in the CAS program? So maybe you can add that to the list of questions to respond to now. Thank you.
Okay, Chichi, can I start?
Yes, please.
Okay, yes, thank you very much. I'll start with Dr. Yusuf question, asking when we are going to start the implementation. Yes, if you look at what I presented, after coming back from Nadiz, one of the next steps is for us to have this, what we are having and what we are going to have next week. From there, we have a TOR, and we start having we come up with a work plan. Yes, I think it's good to note that for the campaign, we're talking about the preventive campaign, and we are having this year. I think if you look at our plan from 2024 to 2025, what we have tried to do basically is to mapping out all the campaign for this year and next year, not only for vaccine diseases, but also for others from the Federal Ministry of Health, the NTD, the nutrition, and what have you. And I'm sure work have started on that and see how we can bring them together. For the campaign, I mean the one we have for this year, we have the measles and we have the yellow fever. We call it integrated SIA for this year. All will happen in the third and fourth quarter of the year, that is September and October implementation. We're about to start the planning. And it's good to note that the campaign effectiveness is not really about the code delivery. It can be, we can do planning together, the micro planning, the ACSM, and other things. Because when you want to even do code delivery, you have to look at the target population you are targeting. So we are working on that, and as we go on with the CAS customization, and you'll be seeing what the team is doing. For Dr. Adamu, thank you very much. The OB, for the polio team, I even believe that Dr. Usman is supposed to be part of us here because he should have also the link. We are in talk with the polio team, and we have the national OBR in last quarter in 18 states that you said, and we've agreed that we are going to be meeting regularly to see how we can how this can be done together so that we can have integrated campaign with the polio. As you recall, we have done that with polio when you were there before. We've done that in Kwara, KB, and some states. which was successful in 2022. So we are in talk with the polio team and see how we can integrate in the last quarter, of the year. Yes, for the micro planning, somebody asked about the the planning. Yeah, is what, as I've said, we are about to start the planning. And part of what we are doing is aligning with the CAS recommendation. We, by tomorrow, we'll be engaging the state, 26 states that will be implementing the vaccine compatible SIA this year, so that we also hear from them and also know their plan also, so that it won't be from top to bottom. They should be carried along, and that is what we do when time we customize the CAS strategy. For the nutrition, I think we are, as I've told you, we are mapping out all the intervention, and I believe nutrition aspect is also part of what we are doing. So maybe because you joined it, that's why you asked that question. So thank you. I don't know whether my colleagues have other things to add. I think I have the things below and other people here that can also talk to what I've just spoken to. Thank you.
Thank you, Dr. Hassan. I'll just add that just to further um, give you the assurance on the bit of the nutrition, we have a representative from the nutrition unit also as a member of the TWG so they'll be part and parcel of the entire process, I can assure you that. And then on the part of the outbreaks, this was actually raised as one of the key areas that will be looked into when developing the TORs at the TWG meeting that will be happening next week. So we are aware that outbreaks would be kind of an issue since they're spontaneous, and that's really little room for planning in that regard. But part of the plan for the CAS for Nigeria is to look at how, nonetheless, it can be delivered in a more effective manner if possible. So I think we have other hands up. We have Kolawole Salami. Can you go next?
Thank you very much for the presentation. So my name is my question has definitely been partially answered.
Sorry, we can't really hear you.
I can't hear you too.
Hello?
Yes, could you just speak up a bit?
Okay, yeah, thanks. I said my name is Kolawole Salami from WHO HQ. So my question has been partially answered. He wanted to know if we have access to the link, links bridge assessment for Nigeria, and that has been partially answered. Also, Dr. Hassan has also answered part of my question, because I wanted to know if there are low-hanging fruits that we could quickly work on, and with regards to the campaign that we are planning or that is already taking place that could be integrated. And at the back of my mind, I'm looking at the Yobe State. I know that Nigeria is the first country to be introducing the new pentavalent conjugate vaccine for meningitis, and it's being done in that state. And I also know that Yobe State is here to do a preventive mass vaccination campaign for yellow fever. So I thought this could be a good opportunity, but probably this is way too early. I'm happy to hear that we are now looking at integrating yellow fever vaccination with the measles-containing vaccine later in the year. I just want to be certain if that is going to take place in Lagos State, based on my limited knowledge of what is going on in Nigeria. That's my question. And then the second question is how the CAS fits into some other initiative like the Big Catch-up that is currently being promoted by WHO. Thank you.
Okay, thank you, Dr. Salami. Can we have Dylan Scanlon?
Hi, good afternoon, everyone. My name is Dylan Scanlon. I'm with the Global Fund with the Nigeria country team. Thank you very much for the presentation. I was especially happy to see the update in terms of the engagement that you've been able to get with the Honorable Minister of Health as well as NPHCDA. But of course, as we all know, many of these large campaigns are implemented partially or completely by non-governmental organizations. So I was wondering if you could speak to a little bit in terms of your plan for engaging with NGOs going forward. So will NGOs be represented in the working groups? Will there be separate meetings for specific disease components? I know the goal is to move away from disease-specific thinking, but would be helpful to understand a little bit the expectations and plan to engage with NGOs so that we can ensure that they're also bought into this plan and contributing the information required to do the mapping, but then also when it comes to exploring the co-implementation, what that might look like. Thank you.
Thank you, Dylan. We'll take one more, then we give the answers. Richard?
Yeah, hi, Richard Reitinger with RTI International. Thank you for the presentation and outlining really what the plan is with regards to the future work in Nigeria. I guess a question for me is obviously phase one of the work by the Health Effectiveness Coalition has really been around the landscaping and laying the groundwork and gathering the evidence for integration. And as you're now focusing on the sort of countries with the CAS, I guess my question is, the prior work that had been done was, smaller scale pilot studies. And so as you're thinking now of really rolling this out at a much larger scale, what are your thoughts in terms of, are you planning to focus on specific elements like planning or implementation, monitoring, evaluation? Or are you going to focus on specific, I guess, conditions or diseases or efforts like, let's say, immunization and malaria or malaria and NTDs? Or is it going to be a combination of all of the elements that I just mentioned? Thank you.
Thank you very much, Richard. I'll just address the last question, and then I think we missed one also, the one about academics, Dr. Hassan. But let me just address the last question. So yes, it's going to be a combination of both. The members elected for the TWG are representatives from the different disease areas. That's nutrition, NTDs, the immunization group, NPCD, and all. And the focus for them as subgroups will be in three main areas. Planning and implementation is one, financing, and then monitoring and evaluation. So it's a combination of both. In terms of the NGOs, yes, they would be carried along. The meeting next week, the first day is all about sensitization of the supporting partners and NGOs that are part and parcel of the health campaigns in Nigeria. So they would be carried along right from the get-go. In terms of actual implementation, because we want the government to be the one driving the force, they will be there more so on a technical and supportive capacity, but they will be part of the process. So I don't know if Dr. Hassan has anything to add to that.
Yes, thank you, I will respond. I think you've answered very much for your question, and I can see you are much aware of what's happening in Nigeria. Yes, MPCD, or let me say the country as a whole, started integrating since 2019. We started with antigen. Later, by 2022, we added other non-antigen like BATS registration, vitamin A, and others. So it's something we have done, but what we are looking at is how do we get it better than what we have been doing. And that's why we are looking at all the recommendation from CAS. For this year, all the campaign will happen, as I said, in September and October. Initially, we thought Yobe and Borno could be taken earlier, but with all the discussion that we have to have a good planning before we go into implementation, everything will happen in September and October now. So for the year, thank you also for the main 5 country vaccine. That is thank you that the country is the first to use it. Not only in Yobe, we also conduct vaccination in Jigawa and also in Bauchi, including Yobe, the 2 AGs. So that is happening now. And we still have a leftover of 1 AG FICA, which we want to respond in Yobe. So they are not in the same, happening at the same time. So Yobe yellow fever will happen in late in the year. So it's only for now, it's only Lagos that we are sure that we are going to integrate yellow fever and measles in Lagos. So the outcome of our meeting on mapping of other intervention will now make us to know how many, which of antigen also can we integrate in this 26 states? And also know that in out of the 26 states that are implementing the SIA this year, we have 10 of them that also conduct the zero dose strategy. So for now, it's Lagos that we know we are integrating yellow fever and measles. For other states, apart from those that are going to implement the zero dose strategy, we are waiting for the outcome after the mapping and looking at working on the cast. So then we'll be able to know whether, like I said, polio is going to implement in last quarter. So it's sure that we are going to also integrate with polio campaign as at that time. And then any other intervention will come together, start planning. But what we are saying now is that we want to start the planning in time. Micro planning will soon start. So we want to map out all these campaigns, come together, start from planning, and look at the one that we can co-deliver at the end of the day. So thank you, and over.
Thank you, Dr. Hassan. The question on where are we in terms of involving the academics, so far that hasn't started, but it's in the plans. I think that's the one question we forgot. So I'll hand over to Letitia for her question. Letitia to unmute.
Maybe while we're waiting for Letitia to unmute, there are a few questions. Okay.
Good afternoon. Letitia on the line. Hello.
Yes, good afternoon. We can hear you.
Yes. Letitia Nwafo from National AIDS, Viral Hepatitis and Sexually Transmitted Infection Control Program, Nigeria, Abuja. Sorry, thank you for the beautiful presentation. I was about talking on implementation, planning and implementation on your thematic areas. There are some diseases that we are mentioned, and I don't know whether it's only those ones you mentioned that you're focusing on, or additional ones will be added when you progress. Did you hear me?
Yes. Thank you very much. So we'll just take the next question, then we'll come back to answer. Dr. Emmanuel.
Thank you, Zaya, for the opportunity to ask questions. I hope you can hear me very well.
Yes, sir, we can hear you.
Good. I give kudos to Nigeria for joining the collaborative actions strategy. I come from the NTD background, and I know my own views may be slightly different, but I really appreciate the immunization folks for talking about so many integration of antigen versus antigen. and to me, that is still operating in their silos. But I think now we need to move out of our various silos and come together as a country. I think the plan Nigeria has is a good one, very excellent. But we now need to begin to work together. And for us to do that, we need to plan. There are so many missed opportunities. I posted that in my question, chat there. Missed opportunities of where low-hanging fruits of integration opportunities are lost because we did not plan and we did not focus ourselves in doing that. I know Nigeria is just starting, but I believe there are a lot of opportunities going beyond immunization, bringing in other, disease, entities that can operate and function collaboratively and efficiently too, together. I believe that that is where we can maximize our efforts. We can save resources. And then also one area that bothers me is the aspect of unifying the remuneration that we give to all these campaign, members, especially those that work at the community, state, and other levels. I am having this challenge when we try to have our first experimental collaboration with NTD and the outbreak response for polio in Edo State. I realized that what the NTD is offering is not the same as what those people are expecting. And then it was a big challenge, trying to join, with them. But we have to do it by adopting what the organization is doing, which is far from what we ordinarily would have expended delivering our deworming medicines. So those are the few things I need to say for now. Thank you very much.
Thank you very much, Dr. Emoka. Mr. Kevin Kinwa.
Thank you, Zaya. I really appreciate the fantastic presentations that have been done. My name is Kevin Kinwa from Chai. Just a quick 2 questions. The first one is on an integrated campaign calendar. I know I'm forgetting the name of the organization have actually been doing quite a bit of work on Linksbridge on putting together integrated campaign calendars that can really assist us with planning for resources that are used across board, just to get a clarification on whether that will be part of what will be implemented. And the second bit is on governance structures. We have various governance structures that have been put in place by the MOH and the partners that are supporting Nigeria in campaigns. I just wanted to get a bit more insight on how these components will be linked to the technical working group that has been put by CAS. Thank you, Zaya. Just to confirm, you were able to hear my questions? Hello?
Yes, we were. Thank you very much.
Oh, thank you.
Waiting for Zaya to come back on. Perhaps she went offline.
Yes, I'm here. Thank you very much. I'll hand it off to Dorcas. This is me, Dorcas. Okay, perhaps Gabriel Afolayan could take it next.
Okay, thank you so much. I'm Gabriel Afolayan from the NTD program of the Federal Ministry of Health. I think mine is a recommendation or probably a suggestion for membership of the TWG. We all know that most of these campaigns are donor driven, and we have done assessment before asking about barrier and enabling factor for integration, and one of it is this restraint coming from the donors. Yeah, so it will be good for, I know in NTD we have the NGDO coalition, so one of them or whoever is leading that group, I'm recommending should be part of the TWG, so that when we have finished discussing what we want to do moving forward, their involvement will not, or lack of involvement will not be a barrier when it's time to implement our
recommendations. So it's good for them to be flexible from their own angle, and we're sure of buy-in from everyone moving forward. So we could identify maybe a representative, probably nutrition, immunization, so that it's not only just government people in that TWG driving this process. That's just my recommendation. Thank you.
Okay, thank you very much, Gabriel. Let me just attend to the last three before we go on to the next set of questions. Gabriel, I'll be meeting you later on so that we collaborate on your point. Thank you very much, Dr. Emoka. Your point about not working in silos, I strongly agree, and it's something that we really need to take into consideration. And then there was a question about add-on for diseases, yes, by Madam Letitia. Yes, the plan is to start with the ones that have been that have been specified. That's malaria, NTDs, nutrition, and then the immunization programs, and then to gradually add on. It's going to be set in stone. There will be a continuation as we go along. So I don't know if Dr. Hassan has anything to add before we move on to the
No, I
last
think
couple of questions.
I
It's
responded
fine.
to
It's
all.
good. Okay. All right. So I'll hand it over to Precious.
Hi, thank you so much. My name is Precious. I'm with China Nigeria, the vaccines team. This is an excellent presentation, and I'm really happy to see that Nigeria is part of the cast and even a front runner in it. My only question is around, and this may have been presented or maybe it did not come out as much for me to notice, but I'm curious as to how the cast team intend to use digitalization for campaign effectiveness. Over.
Sorry, I didn't get that part. How they intend to use what?
Campaign digitalization for campaign effectiveness.
Oh, okay. All right. Okay, so I'll hand it to Sydney Samson.
Thank you very much, Zaya. Good day, everyone, and great presentation from the team. A number of my questions have been addressed, but I would like to just ask one question / comment, and that's on the level of involvement of state level actors. We know that a lot of planning happens at the national level, and the intent is usually to conclude a lot of the planning or get it to a good level and then bring state teams on. But we know that a lot of the challenges are down at the state level, the LGA level, the ward and the facility level when it comes to campaign implementation and all of the constraints they have at those levels. So it would be great to understand as we plan, or as the CAST team, has the TWG at the national level, kickstarting things, what's the level of involvement of representatives, at least of actors across some of those levels, to make sure that their insights are very well captured as the planning and strategies start coming together. The second is also knowing, again, the important role of the subnational levels, what the governance structure will be looking like, given that this is cast at FMOH-led level at national. At the state level, is there a plan to have some sort of platform too that would drive this and coordinate at those subnational levels, given again that the work and the challenges are more pronounced at those levels? Over.
Thank you, Sydney. We'll take from Yusuf.
Thank you, Rhea. Sorry, can you confirm you can hear me?
Yes, we can hear you.
Yes. So for me, I think what will be really interesting for us to hear is building up on what Shehu said around, and then Zaya, also your comment around the other other interventions around NTDs, around malaria, integration within the campaign. I think what will make sense and clarity for key partners across the landscape is to have kind of a milestone-based framework where we see how we move from the current status of integration and how we intend to expand going forward, i.e., how are we integrating within the immunization space, and how are other programs also being brought in to really expand on that over time, so that we could comfortably say we are working on a timeline, say within this year and next year, all immunization specific campaigns will be integrated, and we can comfortably have a single calendar for all activities. And then we could say maybe next year, hypothetically, or by Q4, we'll start integrating vitamin A, nutrition, or malaria. That kind of thing, I think, what will make most sense. For me, this is important because the partners across the on this call also have, some of them have interest in how we expand these campaigns and how we integrate. And I think it will give them the opportunity to also begin to think how they can layer resources around the work that the Federal Ministry of Health or the MPSCDA is doing. Over from my side. Thank you.
Thank you very much, Dr. Yusuf. Shiseti Tuleko.
Yes, thank you very much. My name is James Toleko, and from the Nigeria country team, the Global Fund. I think some of the responses or the questions or discussions have been asked, particularly one mine was on the involvement of the state or the subnational level. Much of, for example, immunization, and so they are mainly driven by the national programs, and then the states just maybe like participating. There are other programs that are more driven by the states. So how the integration becomes very challenging from we look at it from that angle. Then the other, which also my colleague asked, is the involvement of the other INGO or local NGOs who have been doing it, for example, malaria campaigns being led by those teams, and how they come into the technical working group. Someone also asked on the digitalization. There are so many campaigns where there are digital systems that have been involved. That takes a lot of time to try and integrate them. So what I was suggesting that we start small with a vision and then have a very clear work plan on how all those are going to be integrated moving forward. How can the digital or the technology piece can come in? There are some digital maps that are being used for some of the campaigns, for example, ITM campaigns for malaria, and then also for measles. And so how can those be integrated so that we move as we go? So my suggestion will start small with a big vision and stick to that work plan as we move forward. Then the other programs can come in. Over, please.
Thank you very much. We're running out of time, so there are some questions in the chat box. I think we would respond to those. For further questions, I think we would leave a link for an email, so you could direct all the questions there. Just to quickly go through some of the questions. In terms of the... Okay, Dr. Hassan, please.
Okay, yeah, let me start from Sydney. I don't know whether you joined that time. I mentioned that one of the things we want to do differently is to involve the people at the subnational level. As I said, tomorrow we're like on our side, we're engaging all the states that will be implementing SIA this year. Part of the plan is to also request from them their own plan too. What are the plans they have in the states? So that it will not be as if we are the one planning, we are just pushing to them. So we can even know what is their own plan, as at that period we want to also conduct the SIA. So it's part of the plan we have. And also, I said the other time too, for the feasibility assessment, where people will be interviewed. The key people at the subnational level, at the zonal level, and also at the state level that are involved in campaign. Part of the people we have identified that will be interviewed so that we can also understand some of the challenges and what have you, and also hear some things from them. So thank you. That's what I have. Over to you, Zaya.
Okay, thank you. I think with regards to the comment from Precious, Chichi, do you mind?
Thanks, Sayer. Just to say that I know that Chai is working on the campaign digitization, and we've been in touch with between Linksbridge, who are working on the campaign mapping, and the Chai team that's working on the digitization piece. They've been actually talking, and they are still talking this week to see how we can really merge all of these efforts together. If there are other organizations that are working on digitization, I think it would be great to reach out to Linksbridge or to Chai. They will be part of the stakeholder TWG next week, where we hope to share all these learnings from the different mapping and digitization work. Essentially, we want all the work around monitoring and evaluation mapping to really just come together so that it could help to inform how we are moving forward with which campaigns to co-deliver and which campaigns can still run in isolation. So just want to let you know, overall, we are working and seeking out where efforts are already ongoing and seeing how we can really bring those together to make sure that everyone is in alignment. Over back to you, Zaire.
Thank you very much, Chichi. I'll just add on the issue of the subnational, as in bringing it down to the implementation points, other than the feasibility assessment that is being done, because this is also being shared from the Office of the Honorable Minister for Health and Social Welfare. There will be involvement of the Health Commissioners Forum as well as the National Governors Forum. So this will be domesticated at the state level when the time arises. So on this note, I think we could call it a day. Thank you very much for everyone that was able to attend. The links would be shared, all the necessary documents will be shared, and you could reach us on the email that Chichi is going to drop in the inbox. Thank you, everybody.